Hi all, Dr. Raman Sakhuja here, Professor of Psychiatry and a consultant psychiatrist. Welcome to our YouTube channel. Over here, please make sure that you subscribe, like, share, comment, and please press that bell icon so that you get the notifications of all the upcoming videos. So in this video, I'm going to be discussing 3 facts and a bonus to help with relief of anxiety and panic. So let us dive right in and understand the number 1 concept, and that is whether we should be calling it as an attack or something else. The very word attack often conjures up an image of something that is threatening or something that is uncomfortable, and we have to be ready to do something about that. And that is precisely why using the word attack can sometimes not be the most efficient way to relieve the panic that you're getting. Instead, if we understand that what is happening in that panic, and as commonly called the panic attack, is essentially that the brain is giving us an alarm, and that alarm is often a protective and a false alarm that there is something that we have picked up that is uncomfortable, and that we need to do something to change the experience of that panic. So it is important to remember that whenever someone experiences an attack of anxiety, or as commonly called as a panic attack, if we change the word that we use to ourselves and understand it as a protective false alarm set up by the system, by our brain, to indicate that there is something that needs to be changed because we are feeling uncomfortable about something, that often can be helpful in changing the perception of that panic attack. Number 2 fact, that the symptoms that someone gets in a panic or an attack of anxiety or a panic attack are actually simply the consequences of that protective mechanism that the brain is gone into, and those symptoms are all as a result of the brain being in that alert mode or a fight and flight mode where something needs to be done to change something. So those symptoms that someone gets, anxiety, of feeling shortness of breath, palpitations, tremulousness, sweaty palms, feeling as if you might faint or as if you might go crazy, and several central nervous system as well as peripheral nervous system symptoms are basically just the consequences of that false protective alarm being activated. Fact number 3, the symptoms that you get in those conditions are not life-threatening. It does not mean that someone will go crazy or that someone would die or have a massive heart attack or any other sinister thing going on. It simply means that there is something that the brain has been alerted to, picked up that false alarm, and that something needs to be done to change and go back to the baseline. Whilst I said 3 facts, I'm adding in another bonus fact, which is that the symptoms of any panic attack or the false protective alarm will not last forever and ever, because it is impossible for the human body to respond in a way where the anxiety levels keep going up and staying up. Things will go up, symptoms will go up, but eventually they will come down. So there is definitely a peak, and then the symptoms will eventually resolve. Sometimes it may take longer for some, for others it may take a short time. So the point is that they cannot last forever. The bonus thing for this video is, how do we prevent these attacks or these panic things to happen again and again? And that is where the practice of breathing exercises, mindfulness, psychological interventions, if need be, can be useful. And if it is deemed to be a disorder, then there is definitely a role of medications for the panic disorders. And if that is the case, it is best to go and see a professional to help you with choosing the right medication should that be needed. Thank you very much all for watching this video till the end, and please don't forget to subscribe, share, like, comment, and press that bell icon to make sure that you get all notifications of all our upcoming videos. See you next time.